Okay, hello everyone. Let's congratulate Dr. Aakash Singh, a proud Damsonian. He secured a rank 63 in May AIIMS postgraduate entrance exams. Heartiest congratulations, Aakash.
Thanks a lot, ma'am. It's a pleasure sitting here. I mean, I always dreamt of something like this. So yeah, it's a very proud moment for me.
Great.
So I would like to, thank. I mean, starting with first, I would like to thank God because things have been kind to me. I have been in ups and lows, and God has seen me through. I would like to thank my parents. Their dedicated efforts toward me. They're always supportive. They never questioned any of my decisions, although some of them were wrong. But we always learn from our mistakes.
Okay. Yes,
not an issue with that. And then I will especially like to thank my mother. When I was living in Delhi alone for my exams last session, she came and she stayed for 2 months with me, all alone in a small flat of mine. So that's a huge thing. Whatever I've got, I would like to attribute it to her.
Definitely.
And specifically, I would like to thank 2 people apart from all my other friends. One is Dr. Aarti. She has been like a very good friend of mine, our support system throughout. Although she has probably not done so well in her exams, but she has helped me, be mentally stable. Nice. And second, a very, very special thanks to Dr. Manaswini Bhatt, or Damsonian, who has got...
she's the proud Damsonian and she's a wonderful
rank
person.
3 in May AIIMS. I wanted to replicate that, but there were things which I had my counseling 4 days before, so I stopped reading. But she really motivated me, and she actually made me feel I belong here and I can actually do things.
Yes.
The inspiring part. I was working in AIIMS with her, so it was a huge pleasure and I feel very lucky to be with her. I mean, that was the best thing which has happened for me in 2017. Meeting her and she inspiring me to do things.
That's great.
So yeah, that was my thank list.
No, you should definitely thank people
and
that you want
to.
Specifically
Sumer sir and Deepthi ma'am. I mean, DAMS, this is it. I mean, I'm pretty new to this. Like, I've just done the TND part, which also I was forced to drop in between because of my
exams and
my state counseling. My state people were so unfriendly towards us and so untiming. They were timed very poorly for the counseling, and all was timed very poorly. 2nd May was the counseling, and then I lost out 5 days, but that's okay. So yeah, I mean, this is like when I came here, I realized these people are a class apart. I mean, obviously there are other people who are doing the job, but these people do it in a professional way.
That's
in a way way beyond. I mean, I was just telling ma'am just now also ki someone has actually done even regular and TND. I mean, I had not even revised my TND notes. So I bagged the live classes which I saw. I mean, the experience of actually giving an exam and committing those silly mistakes when the discussion is there, and those brainstorming discussions, they actually make your mind work. That is what is important. Not that you read that part, come get rank 1 in TND. That's not going to help much. You need to stimulate your brain. That is the basic idea.
Keep learning new things.
Keep learning. You need to learn how you have to tackle a new question in the exam. Obviously, exams I was little disappointed with the AIIMS paper because it was kind of, you said it was little here and there copied and all, but okay. But yeah, you actually need to learn how to tackle new questions. That is what these people teach in the best way. Sumer sir is a motivation at par excellence. I mean, I don't think there's anything near to that. So yeah, that's why I'm telling ma'am, and the amount of effort these people put in, the amount of material and the amount of, things they deliver, I don't think anything can be beyond this. So guys, if you actually join this and you don't see through, you need to look at yourself. No one can even think to question the quality on this. So I felt very good ki yes, last my AIIMS rank was probably very poor. Shall I tell it?
Yes, you can say whatever you want to.
It was 1388, and then from there I've come to 60. That's a huge jump, and I was working. I mean, that's one thing I can feel good about myself, is like I was very opposed to the idea of sitting and reading. I mean, I didn't like that stagnation sort of a thing. So I was working in AIIMS for the last 9 months, and apart from that I was doing the TND, and I wanted to keep myself busy. I wanted to keep doing smart work instead of hard work. So I worked hard.
That is true.
And I worked smart also. So yeah, that way this was really helpful. So a huge jump, as you can see, with just a small TND, and then these people are experts at everything, pre-foundation, foundation and all. So guys, this is it about the coaching part. So I would like to thank the entire faculty. The tech team is very good. I mean, the tech course, the DAMS cloud, the ebooks, guys, I mean, this is unlimited. You don't have to, even if you don't even attend the regular class, you can as well just go through those books and all. That will see you through. So yeah, special thanks to them. They have been the bridge from, I was getting ranks like 100, 150. My first attempt I got 300 in AIIMS.
You told us that.
150 in JIPMER and 120 in PGI. So to actually crack into the magical figures of double digit, this was the bridge, and I'm so thankful for that, ma'am.
Thank you so much. That's very, very kind of you. And I think he's been saying it all by himself. And he's asking, "Can I say this?" I said, "Of course you can. It's live, and you can say whatever you want to say. It's your day, and you've done well, and you totally deserve it."
Yeah, and I have joined. I've got a NEET rank of 700, state rank of 13, and I've taken MS
That's
Orthopedics
wonderful.
at NIMS. I was telling ma'am.
So yes, he's going to pursue orthopedics at NIMS, and
In
it's a
most
brilliant
probabilities.
institute. Yes, most probabilities. Yes.
And AIIMS also I've got a good rank, and then I've got options open, like
Yes.
we're discussing with sir, like ophthalmology and then pediatric surgery, infectious disease. I might think over, but then I'm happy at my home.
He's happy.
I've been out of the
content.
comfort zone for a
Long time.
while.
Yeah.
I think I would probably crawl back into that. It's a unmatched feeling staying at home and doing your PG. I mean, if you're doing that, you're probably the luckiest person. Nothing can get more lucky than that.
Indeed, indeed. And Aakash, since you've managed it in a small time, as you've said it yourself as well, so your juniors would definitely want to know what is the mantra behind it, doing it in 4-5 months time, and getting a double-digit rank. Although you had been getting good ranks even before that, but yes, as you said, converting it into the magical figures matters.
See, ma'am, basically you need to have a strong foundation, and foundation doesn't come by spoon feeding. You have to put in your effort, your individual effort. Suppose whatever is taught in the class also, unless you actually go back, you revisit it yourself, you do it obviously you're going to give the exam, no one else is going to come and write your paper. So for me it has been, throughout my MBBS I followed standard books. I read books like Guyton, Robbins, in and out. Robbins I still feel proud. I tell my juniors I read it 13 times in and out.
Okay.
So I feel really good about that. I've read all the standard books. In second year I was very disappointed with my prof exam, because even after reading Robbins so much, I ended up getting not missing distinction by a whisker, whereas I got it in pharma and micro. I felt little low, and then I didn't read Parsons that much. But yeah, end of the day I realized guys, don't go by professional exams. Whatever you score in that and all, it is irrelevant. You need to understand the concepts.
Yes,
so
very
yeah,
important.
basic is MBBS. I mean, nothing
because
can
once
suffice
you
that.
do with your concepts, you can learn the application of it.
You can brush it over.
Yes,
And
exactly.
application is important. So if you don't have concept, unfortunately what happens with majority of the people, like I've seen in my batch also, they relax, and then at the end they start learning the concepts in.
Yes.
Nothing can substitute you learning the basic concepts in MBBS. Once you do that, you have a strong foundation. You can always go out and excel and do whatever you want. Time will not be an issue then.
That's a wise piece of advice. So start early, get your concepts clear, and
read good books. Please don't.
Definitely.
No guides. I thank ma'am for that.
We've been saying that in and out.
Guys.
And that's one of the other reason why our notes have a very good hit rate, because we have them directly from the textbooks.
Textbooks.
It is, and that's what we want. We want students can revise the textbooks in a shorter time, and and that's
that
how
is what
we
it should
make
be. I mean, when you're
notes.
reading Robinson, you can't sit and revise the entire Robinson Harrison.
So you do need some concise notes.
Yeah, you need some concise notes. So you can do it as well. These people are doing it in a professional way, in a very good way, in the most possible, best way possible. So yeah, that is the basic idea. There's nothing new. It's just not a rocket science.
What about importance of practicing questions, like giving the tests here and maybe giving grand test or mock tests?
Yes. When you're reading, I never actually read for the as I said, I was working, but yeah, ideal approach would be you would have to strike a balance. When I was doing it in my internship time, for every subject, even for a short subject, I at least had a target of at least 1,000 to 1,500 questions. You need to practice day in and day out. Questions should be apart from reading, and you should do it fast, because
you should do them like a test itself.
See, what I feel is at least when you're preparing, probably once in a fortnight or once in a month, you should go and give a grand test. Just even if you're not prepared, even if you're not done with all the subject, don't fear. Just go and give and just see where you are. Because that's not going to decide what you take in future. So don't get scared, don't be apprehensive. Yes. So yeah, apart from that, when you're doing a subject, always put some time to do the MCQs, and try doing the MCQs from books. I've read some very poor guides for surgery. I'm sorry to say that. I felt very disappointed. I put in 3 weeks of my hard-earned time in internship, which was very difficult for me, and then I felt cheated. So
guys, stay away from guides. Now the faculty keeps saying that, but you have to hear it from the toppers itself, and I am sure when they say it is just a reinforcement for you people, right? So do not read
go
guides.
to your clinics, please
the
do not.
pattern has changed. It is no longer.
Thoroughly. Yes, it is not at all. I mean, who cares of most common and all? Hardly such questions come. It's all about, you know, what next, what best. And yeah, another thing I would like to specify is, do not bunk your postings. Clinical posting, nothing can suffice that. And if you are targeting for at least AIIMS, they ask you this only: what next, what best. This you cannot learn unless you actually go deal with the patient, do it yourself. So 2 basic things: practice and read good books. No shortcuts. See, no guide. Even if you read any guide in and out, there's no guarantee you'll get 100% in that subject.
Yes.
So why not? And guides are what? They copy paste from the books.
Yes.
So
that's quite
there's
true.
no point in, you know, actually doing something substandard. Stick to the best standard things.
That's a wise piece of advice. And did you give the mock and attend the visual session?
Visual part is very good. I must say the AIIMS discussion, there were questions. Actually, I thought it was lifted from that. So yes, it was too. Yes, there were many actually. Directly, so there were a couple, and then indirectly, yes, more or less, you could always correlate. And then I was unfortunate to miss out on PGI discussion because I was in short of time. But yes, guys, discussion, the visual part, visual is like really important for AIIMS at least.
Yes, even for NEET, because nowadays they do have a lot of questions even in NEET. So almost all exams except PGI has been asking a lot of visuals.
So visuals, no substitute. See, the ideal way to tackle visuals is when you are reading itself, you can actually, you know, standard books, all they pick up the images from the most of the standard books, and these people do it in a more professional way. So if you're, that is what I said, if you read the standard books, everything will get covered. And if you're doing it in the rare site, in the hind view, you can always do it in this way, like, you know, the DVT part, I don't think nothing suffices that. Nothing can be compared to that, so it will cover everything.
That's great. Okay, and any advice that you want to give to your juniors on whether they can do it or not in a short span of time, and you know, what should be their approach? Although I do agree that approach could be different for different people and different things work out for different people.
See, things happen. I mean, you need to keep believing. There are lows. I also went through like very bad last November. I was very sure I got a double-digit rank in AIIMS, and I told you I got a horrible rank. And but again, good thing happened. The next day of my AIIMS rank, I got to know my PGI. I scored 60th rank in PGI last November also. So yeah, you need to believe. You need to just have this blind belief that hard work never goes waste. If you have actually worked hard,
important. So you have to stay positive.
If you have worked hard, you will succeed. There's no doubt about that. Absolutely no doubt. Yeah, it might take some time.
Yes,
but
there might be a delay,
bound to happen.
But not a denying, right?
Obviously not. It is bound to happen. So guys, take that.
So that is again a very, very important note from Aakash.
And last thing, ma'am, I would like to thank a couple of my faculties. And I mean, I'm very proud of. I've done my MBBS from Gandhi Medical College, Hyderabad. And then off late, what I'm seeing is like, you know, the inspiration part. Like as a as a first clinical semester, when you enter the hospitals and all, not many people give you so much importance. They're always behind exam going people, exam going students, exam going. So yeah, I was very lucky. I had very good faculty. My first posting was medicine posting. I would especially like to thank Dr. Deepak. I mean, he actually took interest in the students, and he actually made us feel that we belong here. And that's very important. You need to get inspired, only then you can work hard. Things happen when a source of inspiration is driving you. So I was really thankful for that, that they actually inspired me. And then there were things which I did in my first clinical semester, which I did in lumbar puncture when I was in second year. People do that in internships. So yeah, my initial clinical semesters, even in surgery, I would like to specifically thank Dr. N.V.N. Reddy. He let me into the OT. He showed me things. He inspired me. I mean, a lot of my success now, at least the building block of it was set there, because I was inspired. I was like, yes, I need to do something. I need to, you know, rise above the, you know, normal things. So yeah, I really want to thank to them. They have been instrumental in whatever I've achieved.
That's right. We always should be grateful to people around, and you know, that's how the world comes over. You be grateful to someone, and someone would be grateful to you, and we have to keep giving whatever we can to people around.
Yeah,
right?
You should always share the knowledge.
So like he is sharing his positive note to you people to inspire you, to tell you that even you can do it just the way he did it. So once again, heartiest congratulations, Aakash. I wish you a very bright future ahead, and may God bless you. Thank you so much for being here.
Thank you, ma'am. My pleasure, ma'am. Thanks a lot.